Also, did everyone sign in? If you haven't, please do sign in. I'm just gonna real quick go over kind of like the instruments in these trays. It's not gonna be super long. You also don't have to know everything and what it does, but just kind of the main pieces that either are missing or a bioburden elsewhere. There's always kind of like the problem child in each tray. So I'm just gonna go over what we do for hips specifically and then knees. We'll just run through it. If you have questions, please just shout them out. But first we'll start with our hips. A similar, or not similar, it's gonna be the same piece that we use for knees and hips. We call it the mix, or just like the power tray. It's just this gun. It gives power to a saw blade, gives power to a reamer. Super simple to clean. This doesn't really get super dirty other than like bone, maybe like kind of splashing back on it. So obviously just cleaning on the inside, it's pretty straightforward. This one never really is an issue. You just clean as is. When you do your pre-wash, obviously keep this closed. If this is open, that could get damaged really easily. So just make sure when you're like rinsing it and stuff, this cap is closed. Sometimes we've had these break off and go missing, so just let us know if you need a replacement and we'll send one in. But it won't work if this is like getting soaked. So that's really the only thing about this. You're gonna see these a lot. We personally have issues with these. Sometimes like they'll give us errors, so we send them out and get new ones in, replaced. So you're gonna see this a lot down here quite a bit. So just get familiar with that. It's not hard to clean. Again, I don't really have issues with it. The other thing I will point out is there's actually little screws, really tiny screws like right here. You can barely even see them. If you find that they're loose, if you have like a really tiny Allen wrench, you can tighten them down. If not, again, let us know. But that's just like trying to point out all the things that I've seen happen to them. Not too much. So that's straightforward, hips and knees.
I do have one question. Is
Yes.
this submergible?
I don't believe so. I'm gonna send you probably specifically the actual protocol, because I will admit I am not an expert on like the actual sterilization.
Okay.
I will send you all the information in terms of like what they say on paper to go over for cleaning.
Okay.
I don't know that off the top of my head.
Okay, that's fine.
So is this steam or is it
I'm gonna guess it's steam. Yeah.
Okay, so
But I
then,
will 100% let you guys know as soon as I look up the other two.
yeah, and I'll send over a whole protocol if you guys want to print out, just to, like have it as reference. I personally, none of us have been trained on sterilization, like in terms of what we have to do and how to clean stuff, which is not very helpful when it comes to these. But I'll send you everything I have so I can help. You have a question?
Oh, no.
Oh, okay. Okay. All right, so we'll just pop into the hip stuff. This little tray here, we always need this for hip. You'll see that there's reamers in here. It's not, we can't use it like mixed in for a manual case. This is specifically for robotic cases only. These pieces are very, very, very expensive. We've had them go missing before because they get mixed in with like a manual tray. Just please keep in mind if it says Stryker or MAKO on it and it's missing, let us know. This alone is like 20 grand. So it's really, really important that we keep everything in here. The biggest issues that we have in this tray are bioburden just in the impaction site. There's little holes at the top of it. If you take little Q-tip brushes, also on that hole on the side, this will twist. And this is impacting a cup and the acetabular, and there's gonna be bone in here. It's a pain in the butt. We've had complaints, and I think we're trying to work on a better system for you guys. But that's a big bioburden like problem that we have, is this specific piece. There's also a straight one, same concept, just two different ways to do it. Same thing with the reamer. You've all seen reamers before with manual hips. Obviously, you know, bioburden reasons, pull down, clean it all the way through, all the little divots if you see anything. Again, they should be getting rinsed out in the OR before they come down to you, but just so you know. Things that go missing really frequently out of this pan, because the rest, I wouldn't say we have bioburden issues with this pan. it's mostly just missing because they're small, are these little like hex drivers. This is a screwdriver piece. This is just a bone pin adapter. Everything in Mako trays, which I find really helpful, is that we literally have pictures, and you guys can gather on later and look at it, but we have pictures of like what actually goes on top. So you should be able to kind of visualize, like it's not exact obviously with color, but if you're missing something, you can see like, okay, do I have an extra piece that probably fits there? And we're around to ask, obviously. We'll try to reset them as much as we can before they even get down to you, which we always do, right? But those are the main pieces that tend to go missing out of here. Not really a hard thing to clean in my opinion. Like I haven't heard anything other than the reamers and the impactors that are like tough to clean. So I think that would probably be the only ask, is that those just get high priority when you're cleaning these trays. So that one is pretty straightforward. This one here gets a little bit trickier. There's a lot of little pieces when it comes to these two big trays here for hips and knees. This little piece specifically, you're gonna see a lot of these in the knee and hip tray. So tiny, so easy to lose. Also, these attach to other units in this tray. So it can come down. Let me try to connect it. This shouldn't happen because we're always taking them apart, but if for some reason you get something and it looks like this always comes apart. If you see these little like nuts on it and they can loosen up, that means it's separated. So if these come back and they're connected, which I've seen so many times at different hospitals, the whole tray is contaminated. These sit on your bone. This part kind of goes down into your flesh. So a lot of times underneath here and through this hole, just take a brush, because a lot of bioburden and skin will get like trapped there. Gross, but we've all seen it. So that's just something to keep in mind. Anything like this is sitting on bone, like with these like pegs in it. So again, just little brushes are the best way to do it, shooting like water through it. And again, hopefully we're cleaning them in the room so it's not too much work for you guys. These things, with the little like attachment sites on them, we have disposables that go on top of them. They look like black little satellite dishes. If they come down, which they shouldn't, they just pop off. You can just rip them off and they're just disposable. You just throw them out. You shouldn't see that. We take them off almost every single time. So again, just so you know, this probe, I don't know if it's worth pointing out. You guys probably wouldn't have an issue with this, but the end of it, let's just make sure it's not getting bent. It's supposed to be a sharp probe for a reason, because it takes points on your bone. This is how we map a bone model to match it to the CT scan. So just really important. We're keeping this like, you know, safe, I guess. Any questions so far on this tray?
You said that sounded like this is plastic.
Yes, so these are not, but the pieces that go on the satellite dishes, yeah. We call them Visidiscs, if you hear that too. Those are, yeah, they're like some type of plastic. You just rip them off if they break. I don't care, throw them out. This cap just goes over the mix here, just so you know what it is. Not saying we can throw it out, but it's not super important, so like the day will go on if we're missing that. A couple things we cannot do cases with if things are missing. If that blue probe is missing, we cannot do a case. This has been lost many times before in my experience doing this job. I don't really know how it gets missed, because there's like, you know, a big spot for it. So if you're missing a really big piece, even a small piece, it's just worth asking us. We're always gonna be around. Like if you wanna just call up and say, hey, can I talk to a Mako rep? We'll come down and help you find it, but it's, yeah, we can't even start cases without that, so it's super important that we have it. And then underneath, we have some bigger things, more of those, we call them arrays. That's why they're called the array trays. They have all these things that we put the Visidiscs on. This is how our camera sees what's on the patient, and can kind of correlate that bone model. So we really only use this one, the two black ones, for a hip case. Again, everything's important, so just keep it in there. This big thing is something that also can have issues. Again, I think this is more expensive than the reamer, so there shouldn't be a reason we're missing it. I mean, I've never had that happen before. It's huge. You can't really miss it. But this is so important and very expensive. So in here, the reamers slide through. Again, you should not be having an issue or these come down, but just so you know, this holds back like a lever, and this is, so again, they should be taken apart before they come down here, but so you know, that's not how they're supposed to be sent back up. It's just a lever pull and you pull it back out. Bone will probably get in here a little bit just because that's your impactor, and when they're banging, it's coming back in. Same concept. You can pull the lever if there's any bone. I can't imagine this gets really dirty back here, so I mean, it is what it is. The bottom of it attaches to the robot, so again, that shouldn't be an issue. It's really just through here that I think if you're gonna see it be real dirty, that's probably where it's gonna be. So that's really it for hip stuff. I think it's really just normal things in terms of what you're used to. Like manual instrumentation, the reamers and stuff, like just watch for bioburden, watch where those pin things are underneath where they're sitting on skin. Cleaning wise, this is just like you do any other Stryker tray, like Stryker knee, hip stuff. Nothing different in terms of protocol there. Any questions on hips? I'm gonna bounce to knee. It's really similar stuff, but there's a lot more pieces in that one. If we don't have or contamination, that we cannot start a case. And I would just stress too, like, I think a lot of places, I'm over at Cleveland Clinic, main campus quite a bit, and our STD department does a really good job, but we just have a lot of things go missing because there's so many little items. And our patients specifically come in to get robotic cases done, and we can go manual if need be, but like I'm sure you can relate if you had a family member get one, just if they're asking for robotic knee surgery, it's really important that we have everything and, you know, can finish out the case the way that the patient requested. So a couple of things in here, really similar to the hip stuff. You're gonna see these little like screw attachments. We call them like array pieces, but you can call them jigs. I don't care. Well, little metal pieces, whatever the name is. So these all get attached to one another, and they sit on here. So these are the pins. They go into your femur. This sits on top. So this shouldn't have too much bone in it. These will. Again, they all get attached. So if they come back screwed together, just know that if there's a little nut on them, it probably can be loosened up and taken apart. Same concept here. The arrays, these never have issues. Just make sure they're in their spot. Bone pin adapter is a little piece. We can use a wire driver if need be, but this gets lost quite a bit, so just know that it says MAKO and it does go in the center of this tray. A really, really tiny piece that is so crazy we cannot do a case without is this little tiny screw. I believe there should be, we can look into getting like a little metal box to keep this in. That's what like most places do, and then you just slide it in the tray. Because I don't know technically if this was screwed in, if you were to send it up, if that would be like sterile.
We do like everything to be apart.
So this little tiny piece screws into here, and this is how we register the arm for any robotic case. So without this piece, we literally cannot do a single hip or knee case. So this is super important. We'll try to get some extra like peel packs in case it is lost. It's so tiny, so it's very easy to lose. But we'll try to get like a little box that we can throw it in, so you always have it in these trays. But just so you know, that's super important. And then bioburden wise, again, just the pin stuff. This pulls down and it has an opening. It's just a lever. If you ever see like something like that, it just means you pull down for cleaning purposes. That shouldn't get too dirty either. The bottom, there's a lot of little like jigs in here. We don't use all that much on the bottom, but these three things are saw attachments, so that's how we actually cut the bone. And these are like our main players. If we don't have these, obviously there's no purpose to do a case. All of the saw attachments have levers in the back, these like big nuts here. So the saw shouldn't come attached, but if for any reason this was closed like that and you can't get underneath it, just pull this back and it unwinds like a lever. So yeah, that's really it for that. And then, yeah, that's really all we have for knee stuff. It's a lot of little pieces, but it's pretty straightforward in terms of like cleaning and what you guys have seen. I would just stress that all this stuff is very expensive since it's robotic and it's new and they want to charge an arm and a leg for it. So just the little pieces, if we could just be mindful if they are missing, just try to reach out to me. I'll try to find them because it's kind of pointless to sterilize a lot of these. If it's something that we're missing, we can't start the case without. So any questions in general? Have you guys seen any Mako like trays anywhere else you've been before? You have? Okay, yeah. So would you say they're all that much different than what you're used to, or yeah? Okay. If you have any questions, like I said, I'll send the protocol on specific cleaning techniques. I don't know if it would be all that much different, but
I was about to ask that. Are these our trays or just loaned in?
no, they are our trays. I think Carrie was explaining that this is something like that they call loaners, but they will live here. Yeah, we have, I believe we have 2 sets.
So
of
we're not going to
everything.
have like a count sheet necessarily because it's something Carrie's going to reset.
Yeah. I can get you like pictures of these and
Okay.
like laminate them, and also note like another thing. One of our doctors is requesting that we have 3 of these in each tray. Obviously, the layout doesn't let us have 3 of these, so I like main campus will just throw one at the bottom of the tray. So we'll probably just end up doing that. So again, another piece to easily lose or slide off the tray when you put it back in. But I can try to laminate like pictures of each layer of tray.
Okay.
That way you have like a reference of like what goes where. And then to add in the little pieces that we're adding as extras, if that's helpful. But yes, they are all ours. I believe we have 2 of the hip and knee trays, actually even 3 for knees, this one. But the power trays we have a lot more of because we use that on all of our cases. So
You said you don't have a count sheet for that?
I would ask,
I think it's going to be like a loaned in thing. We'll get with Carrie and ask her specifically.
yeah, she told me that I think for some reason here in the system it's considered a loaner, but we're keeping them here, so it is a house tray. I don't know why we
Yeah,
wouldn't be
they're
able
just
to.
going to be constantly re-tagged every day, is I think.
Yeah, I think we'll probably see these quite a bit
So
coming
you're gonna
out
make
here.
put on a sticker on there so when we scan it in?
It's just going to be yellow tagged.
Okay.
But we're going to see it a lot, kind of like with a few trays and things like that. So
Yeah. But either way, count sheet or not, I'll try to get you like a reference sheet just so you know everything that goes in.
yeah, we'll
here.
get some pictures.
Yeah,
posted.
yeah. And that's really it. There's a leg holder, but I don't think anyone will use it, and it's just like any other leg holder. I mean, it's not really anything crazy in terms of like what's different between that and another company's leg holder. So if you do see that down here, it's just your simple cleaning process. This is really just the big stuff, as in the little stuff. It's just a bunch of little stuff. So everything says Mako on it though, so if there's ever like a piece like flying around here missing and you don't know where it goes, just triple check if it says Mako, you know where it goes, because it can only come out of like these trays right here. So I hope that's somewhat helpful. If you have any questions, again, my name's Lindsay. I'll be here I think every Tuesday, Thursday, and every other Friday moving forward. I'll be your main point of contact for Mako. Carrie's great. She'll know most of this stuff too. But if I'm around, just come grab me and I'll help you with whatever. If you have questions, cleaning, anything like that, like I'll come down and help. But shouldn't be too bad, but yeah.